Good evening, everyone, and welcome. Thank you so much for joining us. My name is Dr. Diana Ramos, and I am thrilled to be here along with Dr. Hoda Shawaki. She's a nurse practitioner, as well as with Dr. Clayton Chau. We're going to be telling you about the Orange County Perinatal Mental Health Toolkit that we will be launching within the weeks to come. This is a culmination of work that was my focus as president of the Orange County Medical Association. And I was fortunate too that it was Hoda Shawaki's initiative as well as part of her fellowship with the Pritzker Foundation. So this is a product that is a labor of love. It was not just Hoda and myself. It really is a fantastic group of multiple stakeholders, community, professional stakeholders, hospitals here in Orange County. And I'm very proud to say that this is an initiative that is going to be setting the pace for the rest of the state, and it will be emulated, I have no doubt. So today we're going to cover some overview on what the perinatal mental depression and anxiety issues are, as well as have Dr. Chau talk to us about what's happening in Orange County. And then Hoda is actually going to go through the toolkit. So a little bit about myself. I'm a board certified OBGYN and I'm adjunct faculty at the Keck USC School of Medicine. And I'm also a public health leader, and am very thrilled to have had the privilege to have worked with many stakeholders here in Orange County to make this a reality. Dr. Clayton Chau is a director of the Orange County Healthcare Agency, newly appointed. Formerly, he was the Chief Clinical and Strategy Officer for Mind OC, the nonprofit entity which he co-founded to support Be Well OC, a private, public, faith-based academic coalition that aims to transform maternal mental health. So lots of leadership in Dr. Chau. We are privileged that he is taking some time this evening to share what is happening here in Orange County. And Hoda Shawaki is, as I mentioned earlier, she's a nurse practitioner and a pediatric nurse practitioner with certifications in behavioral health and lactation. Her focus has been critical behavior and preventive areas such as obesity prevention, promoting early attachment, and thriving through lactation support and encouraging healthy parent relationships. And she just finished her Pritzker Fellowship with the First Five Orange County. So she has done an amazing job helping me develop this initiative. So thank you all for participating. I would ask that if you haven't, and I think everyone's muted, but just in case, please mute yourself. And there is a chat box, so if you have any questions, please put them in the chat box and we will address them at the end of the presentation. So thank you. So let's get started with perinatal mental health in Orange County. And this is a very critical initiative right now, and it's even become more critical because of the fact that we have COVID that's happening. We're hearing more and more that depending upon your age, the incidence of depression is increasing, especially among our teens right now. Perinatal mental health is even more critical because we know that the impact is not just on the mom, but it's also on the dad. You're going to hear that. You're going to hear from Hoda on that more, and more importantly on the baby and the baby's lifelong trajectory of health. So it really is a critical piece. It's not just the mom, it is the entire family that is impacted. But let's start with a snapshot about Orange County, and I always like to realize what is happening here in Orange County. So here in Orange County, we have 3.2 million people, which is a good amount of people. I believe we are the third largest county in the state. And in Orange County, we had in 2017, over 38,000 births. Now, I want you to notice, though, the trend that of the number of births. The births are actually decreasing. We went from 48,000 in 1996 down to 38,000 in 2017. And in terms of the children in Orange County, we went from 28% in 1995 to 2018 to about 22% of children in Orange County. So now you get a feel for how our population is. So what about perinatal mood and anxiety disorder? So this is going to be just a quick review. When you want to go more in depth and get more of the details, then I would encourage you to go on into the toolkit. It has a lot more information, a lot more resources and opportunities for more in-depth training. So mood is depression and bipolar, and in some rare cases addresses psychosis, and anxiety is generalized anxiety, panic attacks, post-traumatic stress disorder, as well as obsessive compulsive disorders. Really important to note that maternal depression is currently the #1 complication of childbirth and pregnancy in the U.S. We keep on hearing here in California that we've done an amazing job with our maternal mortality numbers and morbidity. We're leading the country in that. But when we look at our data, depression is the #1 complication in pregnancy. Again, remember that it's not just the mom, it's the entire family that is impacted. And so this is important because this is something that can actually be preventable, something that we can actually address if we recognize and screen, more importantly. So in terms of the impact specifically on the outcomes for the obstetric and the neonatal impact, for anxiety disorder, there's an increased incidence of prolonged labor, fetal distress, preterm delivery, spontaneous abortion. Right now in the time of COVID, unfortunately, many of our hospitals have to limit the number of visitors that are in the room with a mom. And many times the anxiety that is maybe underlying with our patients is even more severe because now they're waiting to know if they're going to be staying in the hospital or not, and they have to wait alone. So depending upon the facilities, there may be capability to have somebody there with them, or maybe not. So really important to realize the difference. For the neonate, there's decreased developmental scores and inadaptability, slow mental development at age 2 years old. So really, the impact is there. And with major depression, there's, for the obstetrics, increased incidence of low birth weight, decreased fetal growth, postnatal complications. And again, in this time of COVID right now, many times there's a limited number as to who can actually visit the mom, and it's really important that we at least try to do FaceTime with pregnant moms, with moms who are making sure that they're limiting the number of visitors, especially with the newborn, because maybe we can pick up what some of the, just do some of the questions, the screening questions for depression to make sure that mom is okay, because there's more limited support for the mom. With the newborn, there's increased newborn cortisol and catecholamine levels in a mom that's depressed. The infant crying, rates of admission to neonatal intensive care units are also increased. So all of these mental health conditions can be diagnosed early, and help can be provided to really try and mitigate the negative outcomes for both the mom and the baby. So how often is depression happening in California? So 1 in 5 women suffers from depression, anxiety, or both while pregnant or giving birth. 1 in 5. We're hearing that numbers are even going up even more right now in the time of COVID. And in terms of stressors, they can include poverty, adverse childhood events, and COVID right now. So as far as adverse childhood events, the Surgeon General, Dr. Van Burke, that is her initiative. And now Medi-Cal is actually reimbursing for screening of adverse childhood events. And again, depression impacts the entire family. And you can see here that 20% of women in California either have either prenatal or postpartum depression, 14% have prenatal depressive symptoms, and 13% have postpartum symptoms. In terms of racial and ethnic disparities, we know that this is unfortunately, we see the disparities and we see the same groups affected and impacted. And overall, for prenatal depressive symptoms, the highest rates are among Black women and Latina women, and postpartum and depressive symptoms, again, the highest rates are among Black women and Latina women. Now, really important to realize, though, that it's happening as well in Asian women and white women. So the point here is, are you going to have a patient that has about a 20% chance of having depression, or are you going to have a 10% chance, or 1 in 10? So nobody is immune. Everybody can be susceptible to depression during pregnancy or postpartum. So that's why we have to screen. We have to try and address who can potentially be suffering from depression. So some of the risk factors for depression: a family history, personal family history of depression. Oftentimes I ask the moms if they had a hard time during their adolescence, if they had depression, and many times they'll hear yes. So it's really important to flag to the mom, and more importantly too, to the dad. You know, we need to keep an eye on mom postpartum to make sure that if there is a risk for depression, that we can diagnose it early on, get some help. If there's a history of physical or sexual abuse, intimate partner violence, if it's an unplanned or unwanted pregnancy, stressful life events, COVID for everyone, complications during pregnancy, preterm delivery. Again, if you remember the data on the race, the highest was among Black women have the highest preterm birth rates, low socioeconomic status, lack of social or financial support, and adolescent parenthood. All of these are contributors for risk factors. And pregnancy is the most likely time to experience domestic violence. Homicide is the leading cause of death during pregnancy in the United States. Here in California, we released a report last year highlighting maternal mortality, focusing on depression and suicide. So again, that report also highlights the need to really address perinatal mental health during pregnancy. So we talked about the risk factors. So what's happening here in Orange County regarding those risk factors? Well, you can see here that the percent of women who receive early prenatal care is improving compared to 1991, but still we're only at about 86.9%. It should be 100%, because if we can get early prenatal care, as part of prenatal care, the recommendation is during that first visit to do some depression screening, and hopefully we can identify somebody who's at risk. Percent of infants with low birth rate, remember the preterm birth rate here in Orange County, you can see that we're actually increasing from 5.1 to 5.8. So again, the risk is increasing for somebody who can potentially become depressed. And you can see that the rate of infant mortality, thankfully, is going down. And overall, the birth to teens is going down, which is really good. Again, remember that the teen pregnancy is also a risk factor. So going on to depression going undiagnosed. So nearly 60% of women with symptoms do not receive a diagnosis. So if you have a symptom, we're failing to make a diagnosis. 50% of women with a diagnosis do not receive the treatment. So that's even more important. So even though they have a diagnosis, we're failing them and not providing the treatment. And women often get care in different settings before and after pregnancy. So just because they receive prenatal care in one office, unfortunately, doesn't always mean that they're going to go to that postpartum visit. They may end up going somewhere else, and that history is lost, and the ability to follow up is lost as well. And insurance coverage gaps, particularly among those with Medicaid, are also challenges to care for the vulnerable population. There was a bill that temporarily passed. Well, it wasn't a bill. It was an increase in the budget that allowed for the extension of coverage for mental health in women who were covered by Medi-Cal during pregnancy and lost the coverage after delivery. And that was passed in California, and it was going to be piloted this coming year. But unfortunately, because of the budget deficit, those funds were rescinded. But the policy and the advocacy is so great here in California that we almost had that coverage continued 1 year postpartum. And hopefully, once our budget improves, that opportunity to provide those services will improve as well. So we're talking about the need. We're talking about how common it is. Well, how many professionals are there to be able to provide these services? And this is what we're hearing over and over again. But I don't know if you realize that of all the United States, California has the highest mental health shortage of the nation, the highest. So next is Texas after us. So we don't have enough providers to care for the mental health needs of our women. When you stop to realize that, the number of births in California, 500,000 births, you can appreciate the importance of addressing the mental health issues in pregnant women. So that means that all of us have to step up and participate and be part of the solution. All of us, whether it's an OB, whether it's a pediatrician, family practice, nurse practitioner, whatever the scope, we all need to recognize that the importance of screening for depression and anxiety in any perinatal women. So the other big push that has encouraged us to take action is a couple of bills. So AB 2193 was a bill that was passed on July 2019 that requires obstetric providers to confirm screening for maternal depression at least once during pregnancy or the postpartum period. So that's why it's really important to get prenatal care early on. Remember, Orange County could have an improvement on that so that we can address that need. And then the other bill that was passed on January 1st, 2020 requires, that was implemented, requires hospitals to provide maternal mental health training. So this is on the hospital piece, that maternal mental health training be provided to all staff with pregnant and postpartum women. So again, really making sure that anyone that touches a pregnant mom throughout the course of her pregnancy has the opportunity to at least screen and provide support for the mom. And if that's not enough of an incentive, the bill, there is a HEDIS measure that's actually pending that's looking at prenatal depression screening and follow-up. So there's a lot of work that you can see that is in the works to be passed. This HEDIS measure is awaiting final recommendation and approval. So whatever the incentive is going to be, hopefully it's because we want to do the right thing. We want to practice medicine as best and provide the best care that we possibly can. But sometimes we need a little bit extra encouragement in some of these bills, and HEDIS measures are those that are helping us do the right thing. So we have developed this, the Perinatal Mental Health Toolkit. And as I mentioned, this could not have been possible without all of the help, the leadership of all of these organizations and more that are focusing on improving the perinatal mental health of women here in Orange County. And it is an amazing group of leaders, and the work is continuing on. And the toolkit is a snapshot that is capturing all of the great work that has been done so far. So with that, I thank you very much for the opportunity to share a little bit of the background. And I am now going to be turning it over to Dr. Chau.
Thank you so much, Dr. Ramos and Oda, for inviting me to speak to all of you this evening. I hope you can hear me okay. Yes? Thank you so much, and thank you to all of you who joining this webinar. I think it's very important. I'm just going to make a few key points and then also talk about the programs that we have here at the healthcare agency, and then quickly turn it over so we can dive into the real meat of tonight, so the unreal of the toolkits. And so, as Dr. Ramo have been talking about, these notions of every woman of every culture, age and income level and race can develop perinatal mood and anxiety disorders. And the symptom can appear anytime during pregnancy and the first 12 months after childbirth. And so she already went through some of the risk factor, but as we know, the risk is higher with financial hardship, especially during this pandemic. And we know that it has affected our community in terms of economic difficulty, hardship, and what have you. Poor social support, teenager pregnancy, and in mother of NICU infants. So while Dr. Ram will talk about how these disorders are underdiagnosed, but there are very effective and well-researched treatment options, including counseling, support groups, and medication. But of course, if we have a shortage of professional, that certainly is a barrier to get people into care. Periodic psychosocial screening is recommended by several associations, right, such as the American Academy of Pediatrics, American Academy of Family Physicians, the American College of Obstetrician and Gynecologists. But there's truly no one single national guidelines exist regarding the recommending screening intervals. And we do know that in California, AB 2193 require or recommend screening one time during pregnancy and certainly postpartum period. But consensus from experts recommend that screening should really occur pre-conception, every trimester in the pregnancy, and then well baby visit during the first year. Clearly, we do have a system in terms of payer supporting screening with no charge to the woman or to the young mother. So I would encourage that those of you who work in the medical field that you do this, right? The county has participated with all the organization in Orange County to ensure that we develop a very robust, in my mind, robust program for maternal, child, and adolescent in the county. And with that, I want to let you know what we have available inside the healthcare agency. So the mission of our maternal, child, and adolescent health is to advance Orange County as a place where all women of reproductive age, infants, children, adolescents, and families will live in a safe, healthy, and nurturing environment. So our program is responsible for planning, implementing, and evaluating of services that address the health priorities and primary needs of infants, mother, children, and adolescents and their families in Orange County through ongoing assessment, policy development, and quality assurance. And obviously, we work very closely with our partner in the community. We have many programs such as breastfeeding, comprehensive perinatal services program. We have programs that call Every Woman in Orange County that provide resources for anyone who is thinking of becoming pregnant, is pregnant, or have a new baby. We have programs such as having a healthy pregnancy. We have a case management program called Pregnant and Parenting Teams, specifically concentrating on pregnancy and parenting for teen. Perinatal care, and we even have a perinatal mood and anxiety disorder program that provide education to the community. Next slide, please. So Dr. Ram will talk about the effect of maternal perinatal mood anxiety disorder on the rapid brain development in early childhood, how parents truly play a vital role in this development. And actually, I would go further and say the family support plays really vital role in this development. Because I remember, think back about almost 2 decades ago when one of my sister suffer from panic disorder during her pregnancy. And it was very difficult for her. That was the first time that she ever had any anxiety, let alone panic attack. And I remember during 9 months of pregnancy, pretty much every month she had a panic attack, so severe that my brother-in-law has to take her to an emergency room and they have to give her anxiety medication. And so for confidentiality, I won't tell you which sister, but I can tell you she was very stubborn and didn't want treatment, right? And she said, oh, I'm afraid that it's going to affect my fetus and my child. And despite the fact that the medical profession tell her that, but you suffering from panic attack probably have a worse effect on your infant and on your child. And so it took a while, even though her brother is a psychiatrist, it took a while for us to convince her to get into treatment because it was really, really devastating for her. She was really debilitating every time she has a panic attack. And so I experienced firsthand as somebody who have a loved one who went through this. And so I think that it's not just her husband, but also the entire family has to rally around the woman and make sure that we give all the support and the family help and support the woman make the right decision. Because we do know that perinatal mood and anxiety disorder can leave a negative short and long-term impacts on the child. Next slide, please. All right, so what is the societal cost of perinatal mood and anxiety disorder? In April 2019, we have statistics that the nationally perinatal mood and anxiety disorder, the #1 complications of pregnancy and childbirth. And I think Dr. Ramo have talked about that extensively, but I want to make sure that we all understand that untreated perinatal mood and anxiety disorder are costly and have a multi-generational consequences with an estimated 2.4 billion cost for all birth in 2017. Nationally, the unfortunate piece is, even though we have very effective treatment of all modality, only half of the perinatal women with a diagnosis of depression get treatment. I don't even want to think about postpartum depression and all those, right? It's very difficult for a woman to access care, especially if you don't have insurance. And we can get into the politics of why we should make sure that women postpartum, especially during the postpartum period, that not only the infant, the child, get insurance coverage, but the woman herself gets coverage so that she could also take care of herself. Most of the time in our experience, that the woman's so worried about her infant that she completely forgot that she herself needs to also take care of her own health, not just physically, but also mentally, so that she can be emotionally there for the kid. So we know that for those of you who are mental health, we do know that the mood and the participation of the mother with the child, the interaction between the mother and the child is so important, especially during the first 2 years. So I'm a strong advocate for making sure that women get plenty of access, timely access to care should they have perinatal mood and anxiety disorder. So I'm going to stop there and hand it over to Hoda.
Great, thank you, Dr. Chau. Good evening, everyone, and thank you for tuning in and listening as we share about the OC Perinatal Mental Health Toolkit, which I'm very pleased to walk you through. My name is Hoda Shauki, and I'm a Pritzker Fellow at First 5 Orange County, which is, if you're not familiar with First 5, we were formerly known as Children and Families Commission. Every county in our state has a First 5 commission, and it's our role to ensure that children are born healthy and that they stay on track in their health and development, so that by the time they reach kindergarten, they are developmentally ready for school. I'm pleased to introduce to you this toolkit, which is as Dr. Diana mentioned, a a product of the collective effort of a number of partners in Orange County who are interested in making sure that we have a county-wide system that's able to address the perinatal mental health needs of parents and kids in our community. And in thinking about, in knowing from what you've heard, and knowing that perinatal mood and anxiety disorders, which I often refer to as Pmads, are often missed. Of those who are diagnosed, if only half of the mothers are actually getting treatment, that's a lot of parents who are struggling without any help. And so, while it's important to create a system that promotes the ability for healthcare providers to address this issue, we also wanted this system to include resources for anybody who comes in contact with prenatal to 3 clients, whether mothers, fathers, other types of caregivers, and their young children, because we don't want these Pmads to be missed, and we want to be able to connect people to the supports that actually do exist in our county. So next slide. And so in developing a toolkit that really spoke to a prenatal to 3 perinatal mental health system, our toolkit quickly went from a 3-page resource to a 46-page toolkit. And so in order to make it user-friendly, I want to bring you right to the first page of, or I think this will be the 3rd page on the toolkit, to the table of contents where you can easily identify the topic that you like resources on, and be able to click on it and go immediately to that page, because we know that, again, we're trying to make this relevant to a variety of professionals from a variety of different backgrounds. And so we want you to be able to easily find the resource that is important for you and your clients that you work with. So if you look to the right, you'll see sort of a summary of the different topics that the toolkit is going to address. And I should start by mentioning that the toolkit is currently on the First 5 Orange County website, occhildrenandfamilies.com, I believe. And it's in the new announcement section. It will also be included in the resources page, as well as on eventually the OCMA and the HCA websites as well. Sounds like there might be some background information, so please go ahead and mute yourself if you haven't yet. Next slide, please. One more slide, thank you. So knowing that not only are Pmads very easily treatable, they're also preventable. And so while it's important to be able to identify people who are struggling with perinatal mood and anxiety disorders, we also want to be able to provide resources that could support families and actually prevent them from developing depression and anxiety. And so we begin this toolkit very intentionally with some resources on prevention, because we as providers are in key positions to be able to recommend programs that connect people to the community and to the communities that they're familiar with, so that we prevent them from feeling like they need to raise their child in isolation, especially during this pandemic. So first, I'm going to go through some of the programs that are available to support families, which are on the right column of this slide, and we'll begin with Dads Matter. Again, Pmads are a condition that not only affect the mother, but the entire family. While we know that in Orange County, 1 in 5 women are affected by perinatal mood and anxiety disorders, it also affects 1 in 10 men. And for a man, the highest risk factor for developing a Pmadd is when his partner suffers from it herself. So it's difficult for us to expect the father or other partner to be a support person in Iraq when that person themselves may be struggling. And so we highlight this program on the top of this list called Dads Matter, which is a program that really emphasizes the importance of building strong relationships and having those strong relationships be foundational in the healthy development of that child. So in addition to really supporting strong relationships, this program also connects fathers to other resources that they may need to feel healthy and well, as well as to economic supports as well. which we know could be, which could really help mitigate some of the stress and anxiety that families are feeling right now. So the other program the next program I'll mention is Nami, the National Alliance for Medical Illness in Orange County. They provide a peer mentorship program, which is a one-on-one peer support program for the first 3 months, and it's available to any caregiver the caregiver will pair up with a peer support person who will connect with them on a weekly basis, and also connect them to additional resources if needed. So this again is key because it's a way, when everybody's sheltering in place, it's a way to ensure that families aren't feeling isolated and alone. The next program I want to share on here is Moms Orange County. Moms is one of a number of home visiting programs that are offered in Orange County through First Five's Bridges Network. And not only do they offer home visiting, but they also offer support groups for moms and dads and other caregivers. And they implement a curriculum, a preventive curriculum called ROSE, which you'll see on the left column, and I'll go into that in a moment. So I want to point out that home visiting programs, there's a whole referral guideline in the toolkit that talks about how to refer people to home visiting programs, but that can be that additional resource to really support families on a regular basis so that they don't feel isolated and that they're connected to resources. Next, I mentioned the OC Healthcare Agency's Parent Wellness Program, which Dr. Chau spoke about. They offer free therapy to anybody in the county, whether father, mother, or caregiver during the pregnancy phase or up to 12 months postpartum. It's a really great service, and so there's information in the toolkit on how to refer families to that. They also provide a support group which implements the Mothers and Babies program, which you'll see listed on the left. And so I want to take a moment to talk about those two evidence-based programs that I mentioned, the Mothers and Babies program, as well as the ROSE. Both of these are evidence-based curricula that have been recommended by the U.S. Preventative Services Task Force last year, because both have been able to reduce the risk of postpartum depression by half in high-risk families. So talk about a very effective way in preventing these conditions. Both curricula are very easy to train on, very quick interventions. ROSE is a 4 or 5 week session, and Mothers and Babies is flexible. It can be implemented in 6 weeks or 12 weeks, depending on how the program is run. Both are trainable and both are reimbursable by Medi-Cal. So they're curricula that could be offered one-on-one by a paraprofessional, so it could be even a social worker or a community health worker, but it can also be offered in group settings, and Medi-Cal is reimbursing for both. So while we're happy that Moms in Orange County's Parent Wellness Program are implementing them, we'd really love to see more agencies, whether clinics or community-based programs, getting their staff trained on these curriculum, incorporating them in their own programs. And if you do, we would love to hear about it and collaborate with you on that. Next slide, please. Okay. So shifting away a little bit from the community-based programs moving towards the healthcare supports, I want to point out some of the resources that we've included in here for healthcare providers, because early on when we were conducting our landscape analysis, some of the key barriers that we heard from OBs and pediatricians on why they're hesitant to begin screening for maternal depression and anxiety, and I should say paternal as well, was mentioned that they didn't feel adequately trained enough to be able to discuss the topic of Pmadds. Providers were not clear on billing and reimbursement for spending the time, which we know it takes time to ask the questions and provide counseling and referral. And also people didn't know where to send them. So there was that fear of, well, what if I get a positive result? How can I help that patient, especially if it's like a pediatrician and they feel like the mother or the father is not even their patient. There was this, there was a concern on what resources were available to support them. And so we, in looking back at this algorithm, this pathway sheet that was developed by Orange County Healthcare Agency and the Perinatal Council, we decided to build a toolkit around this. So this is a really great pathway sheet that kind of helps a provider manage or a staff person in the clinic manage how to support a patient depending on what their score is. And so you'll see on here there are listed some risk factors and sort of what to do if somebody is scoring low on their screening. This is an opportunity if somebody's scoring sort of below the cutoff for a Pmadd, this would be an opportunity to consider referring them to home visiting or one of those community-based programs that we just mentioned. For those who have positive scores, there are guidelines on how to help them, and for severe or emergent cases, there are also numbers to call immediately and steps on what to do. Next slide. So the back of this sheet is the list of programs that you can refer somebody to in the county. They're all open and accepting patients right now, and all are offering support virtually. I should also point out that Orange County newly has a intensive outpatient program through Mission Hospital that's also new and available to moms. So this Pmadd pathway sheet is a double-sided sheet, and we recommend that you print it out and keep it in your office, or for some of us who haven't gone back to work yet, that might be your dining room table. But it's a very useful resource to know where to send people. Next slide. So in addition to having the resources of where to refer, and also remembering that there's a gap and there are sometimes barriers that might prevent a mom from getting connected to the maternal mental health programs that exist in our county, we wanted to be able to provide tools for the provider to help stabilize that mom, or if her condition is mild to moderate, that you may be able to help manage her condition while she receives other peer support, for example, or counseling. And so the first treatment and decision-making support tool we wanted to share, it's in our toolkit, is the Lifeline for Moms app. And that's free. It's downloadable on your iPhone or Android. And it uses evidence-based treatment guidelines, which were developed by the MCPAP for Moms team, which is the Massachusetts Child Psychiatric Access Program. They really are the pioneers in developing a lot of the work that the nation looks to when addressing Pmadd. So it's very reliable, and it's a great tool that can even help you decide which medication to start and when to increase doses, and how to know whether a condition is depression versus bipolar disorder, so that you don't start them on the wrong medication. So it's really helpful. We feel that it's a very helpful app. It even has counseling sort of phrases that could help you in knowing what to say depending on how a mom is doing and how you can counsel her. The second resource on here is a psychiatric. There are 2 psychiatric consultation lines that have been generously offered to us by both Dignity Health and the Postpartum Support International. These allow you to call the toll-free number and access in real time a reproductive psychiatrist who is available to consult with you on particular cases. So they love to consult on a particular case. They also love to follow up so that you could receive feedback. And the idea would be that over time, the more people who are able to consult with them, the more comfortable we'll have providers addressing Pmadds and just increase our workforce capacity to address the issue. So next slide. I see a question that's coming into the chat about billing. So speaking of billing, we have included in the toolkit the most recent up-to-date information about billing through Medi-Cal. And there are also guidelines in here from ACOG on the ICD-10 and CPT codes to use as well. I'm wondering if we should take this question now. Okay, I'll finish and then we'll go back to addressing some of the questions. And there is some billing information on the preventive courses as well. That's included in the toolkit. So next we talk about training. So again, one of the barriers is this lack of comfort in addressing an issue that many of us were not trained on during our professional programs. And so there are a few resources on the toolkit as well, varying from 1 to 2 hour short CME courses to extensive CME courses that can actually enable somebody to become certified in perinatal mental health. We do have some providers in Orange County who are certified, but we really would love to see more, especially mental health professionals who are specifically certified in this and really can help support not only the mother, but the developing child who's already going to be impacted by those Pmads. So a great opportunity for somebody who wants to learn more. And then thirdly, we include on here a link to our Maternal Mental Health Symposium, which was held last year. And this is a great resource to refer to staff just to begin acquainting people with what Pmads look like, what some of the symptoms might be, and basic information about the condition. There are 2 wonderful stories that mothers share at the beginning of the symposium, and both illustrate what it looks like when Pmads are not caught early. One of the women actually developed postpartum psychosis, and the other woman had to be admitted for some time until she recovered, and both were because their conditions were not caught earlier. Next slide. So last but not least, if you take nothing away from today's webinar, please know that at the end of the toolkit there are extensive number of brochures and patient education materials that we would love to see being given to families. So some are directed at the mother and talk about the signs to be aware of. If you'll see on this brochure here, that's available in multiple languages in this toolkit. We've included the local resources on the right that they could call. Another important thing for you to remember, if nothing else, is Postpartum Support International. They have an 800 number and they're available anytime to take a call from a mother or father who may not be ready to receive therapy and enroll in a program or even enroll in a support group, but just knowing that there's a number that they could call when they need it could be really helpful to them. So not only do we have brochures with educational information, we also have information on how to support a father, as well as what to do when you know something's wrong, just like Dr. Chau had mentioned his sister, and I've had numerous patients as well as family members when I've known something was wrong, but I didn't know how to bring it up and know what to do. So there's a nice messaging flyer in here that can really empower people to step up and do something rather than remain silent. Next slide. So with that, these are just a few highlights from the toolkit. Again, it's a 46-pager, so there's a lot that we didn't cover, but we would like to open it up here for a little bit of discussion on possible opportunities. So as mentioned, we would really like to utilize the preventive courses such as Mother and Babies and Roses to really empower those within the community, either in clinical practices or in agencies that are serving clients directly, to get trained and be able to provide some of that preventive information through these programs. We would also love to collaborate with any practices that are interested in using the toolkit to start implementing screenings and referrals. So if any of that is interesting to you, please reach out to us and let us know so that we could collaborate. And I think from here, we can open it up to some questions. So I did see one question in the chat, and that was to be Medi-Cal billable for Rose or the Mothers and Babies program, must your site be a Medi-Cal approved certified site? My guess would be yes, but Dr. Ramos, do you know about that?
I don't. I wouldn't know the details, but yeah, I mean, if you're going to bill Medi-Cal, then you, at some level, be a Medi-Cal approved provider. Whether the practice needs to be the approved Medi-Cal approved would be one thing, but I would say check with Medi-Cal, or if you can put your contact in. Actually, we see your name, then maybe we can ask the programs that are actually implementing it and see what their response is, so that we can give you definitive information. But if you want to be a pilot, please put your contact information in the chat box, because right now the developers of the McPat for Moms and of the Rose program are looking for pilot or organizations in California to implement and expand. So they both have received NIH funding to do some directed collaborative implementation. So this is a great opportunity if you're thinking about it. I know one partner has said that maybe making it part of their practice, the breastfeeding support, the Rose program. So, you know, if that's something that may appeal to you while the patients are there getting breastfeeding support, this may be a program that you may want to be trained on and then be able to make it part of what your practice offers.
And Lee, I can definitely follow up with you on that.
Actually,
Thank you very much.
Hold on, Dr. Ramos, because I used to work for a health plan, so I can tell you, if you want to build Medi-Cal, you have to be a registered Medi-Cal provider.
You have your answer.
Well, another opportunity might be to partner up with a clinic who wants to offer it to their patients, and maybe patients can go off-site to your center as a possibility. Go ahead.
But being a Medi-Cal provider, sole provider, is very different than having a site. For example, the child guidance clinics are Medi-Cal approved sites.
Yes.
So that's what I wanted to ask about, a site versus a provider. Thank you.
Yeah.
The next question I saw was, can a first 5 home visiting program provide Rose? Absolutely. So of the two, Rose is the program that will do training for free right now because it's part of a study that they are offering. So we can definitely talk about that, Lisa. Okay, I see. Are you developing a questionnaire that screens for paternal depression? As you mentioned, fathers can develop symptoms of depression during pregnancy. So that's a great question. In the toolkit, we have a number of screening tools, not only for mental health, but also substance use disorder, because we know that the co-occurrence is so high. But to answer your question, the Edinburgh tool that's in there, I believe, was developed for women. However, there's a PHQ patient health questionnaire 2, 4, and 9 that are included in the toolkit, and those are definitely, they work for screening for paternal depression. There's also a GAD-7, a general anxiety disorder screening tool, and that could also be used for both men and women. In addition, there's a specific screening tool in there for, like I said, substance use disorder, and then another one that's specific to teens. So that's not a comprehensive list of all of them, but we included the ones that were reimbursable, and also the commonly used tools.
Okay. I don't think we have any more questions, Hoda, do we? Don't see any more.
We do not. But what I did want to share was that we're going to send out after the presentation, we'll send out a recording of the webinar as well as a short survey that's, I believe, no more than 5 questions. If you would kindly fill that out, we'd really appreciate it.
So thank you everyone for joining us. Dr. Chau, thank you so much. And be on the lookout on the Orange County Medical Association website, as well as First 5 OC, and know that you have an amazing group of leaders here, professionals, community, consumer leaders in Orange County, helping make sure that our mental health is good. So thanks everyone, and have a good evening.
Good evening.
Thank you.